The other thing you talk about as well is that one size does not fit all, that there's a lot of disparities in women's heart health. And one of the most powerful themes in your work is that whole idea that one size doesn't fit all. How do race and ethnicity actually impact cardiovascular risk?
So, race and ethnicity definitely have, a big emphasis when it comes to cardiovascular risk. So, specifically Black and Hispanic. So, cardiovascular disease affects 40% of Black women in the U.S., and Black women have a 40% higher incidence of hypertension and 14% higher incidence of diabetes. So, they have that higher presence of those risk factors, and that leads to more cardiovascular disease. Similar with Hispanic women. So basically, they have a 30% higher risk of death. Hispanic women have 20% higher risk of cardiovascular disease compared to non-Hispanic white women. And when you look at their risk factors, higher risk of obesity, about 44%, diabetes,
Mm.
15% higher. So their risk factors are more significant, and that leads to more risk of developing cardiovascular disease, in addition to genetic variables as well and family history as well. And, going into also all the social determinants of health plays a big role as well here when it comes to ethnicity.
Yeah, that's what I was wondering a little bit is that how much does socioeconomics play into what's going on with women's health? Is it that, is it access to healthcare? Is it access to healthy food? Is it, what are those things that are really impacted? Because it does seem like it is very disproportionately affected for these women. And if you take the genetic side out of it and really just kind of look at the socioeconomic impact of it, I'm curious, what are some of those things that are happening?
So, I mean, social determinants of health definitely play a tremendous role. So, income, can they afford medications? Can they afford good food? We always say, we need to eat healthy, low
Mhm.
cholesterol, low sodium, but, oftentimes the cheaper options are not healthy. They don't have low cholesterol, they don't have low sodium. And then access to healthcare, how hard is it to get to a facility that has clinical care, et cetera, because sometimes these facilities are not present in their community. And
Mm.
that's why community health centers are, something that has been starting to kind of develop more frequently in these areas to really help people by going to their community as opposed to having them having to go out.